And it was probably one of the best things that happened in my life, saved my life, I think.
Late 1970s, it was discussed at the highest level, at the National Commission level, that diabetes was a public health priority. Individuals were experiencing kidney disease, heart disease, eye disease, levels of blindness where 1 in 3 patients with diabetes would develop vision impairment or blindness back in the late 1970s. 1 in 5 would have a heart attack, a stroke, and these were in their 30s, 40s, and 50s. And so it was a priority that we understand what was the mechanism driving complications. So with diabetes, you have high blood sugars. But it really wasn't known that if we could manage high blood sugars and make them as near normal as possible, would these complications go away?
It was right when I was turning 16. I'm just drinking just a crazy amount of liquids. And my mom was a nurse, so she had a good sense of what was taking place. And sure enough, I'm diabetic and started on just a basic insulin therapy, injections.
I was about 14 and a half, and I got really sick with what we thought was a flu. This went on for almost 2 months, at which point I had lost a ton of weight and was down to less than 80 pounds and was just skin and bones. One night, I got up at 3 in the morning to go to the bathroom and fainted on the bathroom floor. Next thing I know, I woke up the next morning. I had all these doctors and nurses staring down at me. I'm like, what's going on? They said, you're diabetic.
I was in my mid-20s, and I started to have increasing thirst. I'd get up middle of the night, classic symptoms, several times. And of course, I'd get up and I'd be really thirsty and I'd have to pee, and then I'd drink a bunch, and then a couple hours later I'd get up again. Then I lost 10 pounds and then 10 more pounds, and I had some foot drag because I had a little neuropathy in my right foot, and my gait was off. And then finally I went in, and the doctor asked me what's going on. I said, well, I've had about a 50-pound weight loss, unexplained. He said, well, I'll tell you what, you have one of two things, that from your symptoms, you either have cancer or you have diabetes.
So this National Commission declared that this was a public health priority. We need to have a trial, which is the gold standard evidence as to what is causing these complications. And so it was termed the glucose hypothesis, sugar hypothesis. If we could normalize this, would this help reduce complications? And so this trial started in 1983, so the first phase was called the Diabetes Control and Complications Trial. And so it compared what was conventionally how we treated patients at the time, with 2 or 3 injections of insulin and these kind of simplistic methods of monitoring blood glucose, versus multiple daily injections. So these multiple daily injections, which was called intensive therapy, versus the conventional. And you were checking your blood sugar for at least 4 to 6 times per day. The trial went on for about 6.5 years. On average, it recruited 1,441 participants, randomized into these 2 treatment arms, and within these treatment arms there are individuals who were just diagnosed with type 1 diabetes, and those who had had their type 1 diabetes for 5 to 15 years, maybe had some earlier complications, because there were 2 real aims here. One, could we prevent the development of these complications, and then could we slow the progression in those who already had the onset of complications already? So they had some early eye or early kidney disease. And so in this trial, it was actually stopped early, and it was stopped early because it was clear that intensive treatment was preventing the earliest complication that we see, which is the eye disease. And so it would be unethical to continue and not treat all the participants with intensive therapy. So the study was stopped. The results were presented at the American Diabetes Association, and it was the shot heard around the world. It really ignited diabetes management. It became the mantra for the diabetes community that we can do better. We can prevent these complications, and we can make diabetes treatment even better. In the early trial, When it was stopped, we saw already that we could prevent 70% of the early stage eye disease, and in those who had already had some early stage, we cut their risk 50% for progression. So we were able to prevent the development and slow the progression of complications. And so when we moved into the EDIC phase, the majority of our participants said, yes, we're in it for the long run. And so they entered this epidemiology of diabetes interventions and complications, which was no longer a trial. It was more of a follow-up observational study. Pumps at the beginning of the study were very rudimentary. Now we can use a pump which will continuously infuse insulin. So you have this similar to your pancreas, something always giving you insulin, and then at meal times you push a button and give yourself additional insulin. And then there was the revolution in continuous glucose monitors. So no more finger sticks and urine dipsticks. You can wear a patch sensor that now every 5 minutes to 15 minutes, you know what your glucose level is.
I guess I'm proud that this is going to be my legacy. When I first became diabetic and I graduated from college and was out in the world on my own, that's when I was scared about the complications. What's going to happen to me 10, 15 years from now? And right now, I don't really worry about that hardly at all anymore. And I owe it to the study, I think.
When I was first diagnosed, people told me that I could expect my life expectancy to be much less because I have type 1 diabetes. I certainly don't believe that now.
We were at the front edge of all of this, and I'm involved in sports. I like to bike, I hike, kayak, I ski, I downhill ski. It's given me the freedom to continue to do and pursue all the things that I love, and don't have to worry that I'm impacted negatively.
Now, with this long-term follow-up of the DCCT edict, we know that if you intensively manage your diabetes, your mortality rate is the same as the general population. And so we've erased that from that worry from families, and that's an important message that we give to patients every time we see them.